Hello dear students, welcome back to my YouTube channel Physiology Learning. Today we are continuing with our ECG series. In the previous videos we saw about history, electrodes and leads, ECG wave generation and the various waveforms in the ECG, that is the PQRST waves. And then in the last video we saw about the ECG papacity. This video is very important. Today's video is going to be on the steps to analyze the various ECG. How do you go about when you get an ECG? So many a times the new students, they tend to get an ECG and they start looking for abnormalities. But never ever do that. Always go in a sequence so that you don't miss out any kind of abnormalities. First thing is, first we have to check whether it is a correct ECG. Then only we can find out whether this abnormality which is seen in this ECG is pertaining to this particular patient. Because sometimes the technician or any other person who is taking the ECG, they also might have taken it wrongly by placing the leads wrongly. So always go with these steps so that you never miss those kind of subtle findings. So first, coming to the analysis of steps of the ECG, the first and foremost important thing is the history of the patient. So always ask a question why this particular ECG was taken in this patient. Whether he had a complaint or it is a routine checkup or it is taken for any other purpose, either an experimental purpose or whatever it may be. So always the history of the patient is important, because sometimes some of the abnormal findings could be interpreted as normal in the subject who is having the particular history. For example, a bradycardia, we are analyzing an ECG and the ECG shows the heart rate is around 50. That is called as bradycardia. So in this patient, we might think that he is having bradycardia and it is an abnormality. But if the patient has an athletic history, suppose the patient is a long-standing athlete, he has done athletic practice for a very longer duration, then this bradycardia can be interpreted as a normal finding in that ECG. And one more thing, this patient might have a high amplitude QRS complex, obviously, because the cardiac hypertrophy is a natural phenomena which happens in athletes. So this also can be normal. So until unless you know the history of the subject, whatever interpretation you are going to make on that particular ECG is not going to be valid. So always know why this ECG was taken and what is the history behind the ECG which was taken in that subject. Then next thing is always confirm the name, age and sex of the subject in the ECG. In the modern day ECG, it comes written in the strip of the ECG, but sometimes even if it is not written, always ask whether that particular ECG which they are holding on to it belongs to them or not. So that is very important, because sometimes the same name and age can be there, or the sex of the individual, and sometimes the same name person can be 2-3 people in a ward. So always make sure that it belongs to the particular person on whom we are going to interpret. Next thing is always check the date and time. You might ask me why it is so important. Many a times the people who are taking ECG, they don't know the difference between astrological thing that is written and the ECG. Why? Because astrology is written for everyone whenever they are born and it is valid for the lifetime. But ECG is not like that. So why I am saying like this is because the patient would have taken an ECG like 3-4 months back when he was going a routine test or a medical checkup. So at that time, he did not have any complaints and he has an ECG strip of that period. But right now, he is having a chest pain and it is indicating the signs of myocardial infarction. But he is showing this ECG. When you read this ECG, the ECG is completely normal. The patient might give you a complaint, but it was not taken at that moment. So always some conditions like the myocardial infarction, they require then acute ECG or an ECG which was done immediately during the time of the symptoms. So the patient might think the ECG which was taken 3 months back, that should show the findings forever in his life. It is not like that. The ECG changes will happen and it will keep on changing throughout his lifespan. So always ask or check whether the date and time of the complaint and date and time of the ECG taken are same, because they never know the difference between an astrological thing that is written and they think that the ECG taken at one point of time is valid throughout his entire life. So it is not like that. So always check these two things. It is very important. Many a times, even the experienced doctors, they have missed some of the findings because they were checking on an ECG which was taken long ahead of the complaint. The next thing is analyze the x-axis and y-axis. In the previous video itself, I have taught you about the calibration. What is the calibration? This is nothing but our ECG paper setting. So whatever the x-axis and y-axis, we have given the calibration that is important. So the standard setting, which I have already discussed in the previous video, kindly go through it if I have not done it. The standard setting for the x-axis is the duration is the paper speed is around 25 millimeter per second. And I told you conditions where we can change this also. Then the y-axis, the standard setting is 10 mm per millivolt. So this should be checked, because further after this, whatever calculations we are going to do, whether you are calculating the rate or anything, that is dependent on these two settings. If these two settings are changed, our interpretation also has to be changed according to this setting that has been done. Next, we will be analyzing the rate. What do you mean by rate? We are going to analyze the heart rate. So in the next video, we will be seeing how do we analyze this heart rate of the, or calculate this heart rate of the individual using the ECG. Next is rhythm. Rhythm means we are going to read the strip and think how whether the P wave is followed by a QRS complex and then a T wave. So we are going to check the rhythm like you do it in the pulse. So rhythm in the pulse also we will do. What we do is we will check the pulse and see whether they are in rhythm, whether they are following a particular pattern or sequence. Here how do we check the rhythm is whether the P wave is followed by a QRS complex, then a T wave, then again a P wave followed by a QRS complex, then a T wave. This kind of analysis will help us to identify some of the conduction blocks. So the rhythm checking has to be done. Then we will check the axis, waves, segments, intervals, and finally come to the abnormalities. Axis, I will have a separate video on this. Axis tells about the position of the heart. Position of the heart can be assessed using the axis. Then already I have given you the normal values for all these three. We are not going to repeat it. Waves, segments, intervals, already the significance of the waves and their normal duration, and when it prolongs, what is the abnormality, that all these things I have discussed in the previous video itself. And then finally at the end only we come to the abnormalities. Many a times once you get an ECG, do not go and search for abnormalities. First go in the sequence and check all these parameters, then only go for the analysis. Especially these parameters we might think lightly, but many a times the mistakes happens there in the initial setup itself. So always make sure that whether those things are done correctly. Then you check the rate, then rhythm, then axis, waves, segments, intervals, and finally the abnormalities. So we are going to make a separate video on the heart rate calculation, axis calculation, and various other abnormalities. If you have any further doubts, kindly drop it in the comment section. I'll be happy to make a new video on it. Thank you so much. Stay tuned for more such videos. Thank you so much.